are kind of overwhelmed. And so for neurological disorders, actually there's been a number of studies that suggest that 1.5 atmospheres is both all you need and probably all you want to apply. And the difference then between 1.3 and 1.5, well, if you do have access to a 1.5 chamber, that's probably great. They tend to be about 10 times more expensive than a 1.3 chamber. If you just have a 1.3 chamber, you'll probably still get beneficial effects, it just may take a little bit longer. And I would also add, people here like Dr. Bradstreet or Professor Kunegi, I would ask them the same question, and they have many, many years of experience of dealing with hyperbaric oxygen therapy, so I would advise you to talk to them as well.
Rana Bibi?
Due to all that intake of oxygen, it does cause an imbalance in the flora, right?
Dysbiosis is the question. Does it induce dysbiosis?
Does it induce dysbiosis?
Because of all that oxygen intake, it does affect the flora.
Yeah, but we find it doesn't necessarily cause like gross imbalances that are going to cause complications later. So it's been shown to, for some like deleterious bacteria, it's been shown to have a beneficial effect by actually killing off those bacteria that typically operate in anaerobic conditions.
But shouldn't kids, autistic kids especially, undergo a course of probiotics or anything to support their flora?
Well, absolutely, and I think this is important to stress that, yeah, as I said, this is just a tool in your toolbox. It's very important to have a proper diet when you are undergoing hyperbaric oxygen therapy or any of these therapies at the same time. You can't just have oxygen therapy and then nothing else. It's a synergistic treatment. You need to manage your diet as well. Yeah.
Yes, but actually, I must say that with my patients, I see sometimes improvement in the feeling because sometimes it's anaerobic flora which causes the problem, and that's very difficult to undertake. And then we say about oxygen therapy sometimes in some treatment of mine, which doesn't just stop the other treatment, actually helps to reduce inflammation and helps to reduce gut problems and helps to recover the gut. That's why I'm so interested in this.
Good. Well, can I say thank you very much, Steve. There is an oxygen chamber in the room next door, and Steve will be very happy to see you inside it. I'm not saying you'll get out of it again, but you will get into it. And if you've got any more questions on hyperbaric chambers, please ask Steve and his staff in the room opposite, which is a breakout room. Thank you very much, Steve. A slight change to the programme. Dr. Jeffrey Bradstreet will speak immediately after lunch, and Dr. Mohammad Almomani from Jordan is going to be the next speaker. I know he treats children for autism. I know he imports huge amounts of Gc-MAF. Apart from that, I can't tell you anything. Dr. Almomani.
Good afternoon, everyone. Glad to be here and here to share with you our experience with Gc-MAF treating mainly kids under the spectrum of autism. For the last 7 months, we have treated more than 400 kids with autism with GcMAF and vitamin D. And the preliminary results are very encouraging and promising. We are now conducting a clinical study on more than 400 kids, but the study is halfway through, and I hope it will be complete in the next 6 months or so. So in the third annual GcMAF conference, hopefully, we will have more and final conclusions about our study. But today I want to share with you the positive and great feedback that I get from parents whose kids get GcMAF over the last 7 months. And at the end of the talk, we'll show you some videos for those kids with signs of improvement in all major symptoms, including speech, awareness, and social skills. But before we go to our videos, I want to just go briefly talk about autism. And I know Dr. Jim Kianci will be talking after lunch in details about complementary therapy for autism causes and symptoms and everything. But here, I'm just going to briefly go through autism spectrum disorder, what does it mean, and what's the main causes and symptoms for this accelerating disorder, which we see for the last decade, more and more kids with autism. And I think the main reason for that is diet and pollution, which is also the main reason for rising cancer in our generation. As most of us know, autism spectrum disorders are very complex disorders. They are neurodevelopmental disorders. I don't call them disease, and I don't call them psychiatrics, and I don't call them genetics. But they are multifactorial, and mainly it's environmental causes. And that's what makes them complex. The onset usually comes after the age of 18 months to 2 years. The kids usually normal until they reach 2 or 2.5 years, then they start getting symptoms of autism. The main sign for autism is regression. Regression and delay in 3 major criteria. The first one is communication. Communication means either verbal or non-verbal, speech, receptive or expressive, and eye contact. The other criteria is social skills. They have lack or very delayed social skills. And the third one is abnormal behaviors. We know that boys are 4 times more liable to get autism than girls. The incidence worldwide is about 1 kid in 10,000. But of course, in each individual country, it varies. For example, in Jordan, it's 1 in 500. I know in USA, it's 1 in 80 or 1 in 100. In the United Kingdom, it's 1 in 80. I heard yesterday that in the United Arab Emirates, it's 1 in 50, which is very alarming. I call autism, the main reason for autism, I call it immune system dysregulation. Immune system dysregulation or dysfunction comes from a variety of reasons. The first one is food allergies. The second is toxins, preservatives in foods, too much vaccinations and preservatives in the vaccines, viral, bacterial, fungal, other causes like poor nutrition, deficiency in vitamins. Diagnosis of autism is very easy, but the problem is treating autistic children. The traditional treatment we used to know for the last 20 or 30 years is ABA therapy, which is applied behavior analysis, which includes special education, speech therapy, occupational therapy, behavioral therapy, etc. The other approach, which is the more important to me, is the biomedical approach, which is treating the causes of autism rather than the symptoms. The biomedical approach includes diet, gluten-free, casein-free, sugar-free diet, detoxification and chelation, removal of heavy metal toxicity, providing supplements and vitamins, giving antivirals, antifungals, antibacterials, hyperbaric oxygen therapy, which we just heard a very nice talk about it, and the new miracle, which is GcMAF injections, which is my main talk about. For the last 7 months, I started giving GcMAF for my children under the spectrum. And we gave more than 400 or even 500 kids with autism. For the initial feedback I got, more than 70% of those kids who got GcMAF gave me positive results. Using GcMAF at least for 8 weeks to 10 weeks. The range of age we gave GcMAF to was 2 years old to 17 years old. The dose I used, I started with 0.1 ml every week, intramuscular injection. Then after 4 weeks, I went up in the dose to 0.15 ml weekly, also intramuscular. And after the 8th week, I raised up the dose to 0.20 ml per week for another 6 weeks, and sometimes to 11 weeks. And now I have kids going on 0.20 ml for 25 weeks. To be honest with you, the good results I saw were after I went up in the dose to 0.20 ml per week. The first 8 months, the first 8 weeks, were just introduction or get the patient to use the low dose of GcMAF to avoid any unexpected reaction. The improvements we have seen so far, reported by the parents and also seeing the kids for follow-up in my clinic, were mainly in the awareness and concentration, followed by receptive speech and then expressive speech. I have seen kids never spoke any words, and after they got 8 weeks of GcMAF, they start talking. They start saying Baba, Mama, Daddy. And some kids, they were talking one word at a time and they start saying sentences. This is great achievement, and to the parents, it's a miracle. Also, we have seen improvements in the social skills. The kids start to play with other kids, to share toys and so forth. Also, behavioral improvements in terms of they become less violent, more social, less moody. But the drawback, I've seen more hyperactive kids with GcMAF. And the other side effect I have seen, which is not really alarming, is low-grade fever with the first 3 or 4 injections. After that, no more low-grade fever we saw. From my experience with this GcMAF for this 400 kids almost, I've seen there was no relation with the age of the child or with the severity of symptoms toward the improvement. So if I see a kid 10-year-old, he might get better than a kid 3-year-old. The same thing applies to the severity of symptoms. I've seen severe autistic children get better than mild or moderate autistic children. So each child responds different. But the main thing about all of that was all of them improved in different levels. Now we're going to show you some videos from kids. Some of them were non-verbal and they start talking. Some of them were like non-social and they start to get social. You will see for yourself now a few videos that we got from parents in the last few months. This child was non-verbal before GcMAF. He never spoke any word. He's about 3 years old now. He told you. He's counting now. He's doing the alphabet in Arabic. Now you will see this child start playing with his brother. They're going to play peekaboo. Now he sees the animal and he names the animal. This child is 3 years old. Her dad will tell you her story.
My daughter
It will take 2 minutes.
3 years old. We started treatment with her a year ago and has improved after losing diet and supplement food speak. But the biggest improvement we have observed is the use of needle GcMAF. Now, we see pictures of hair in nursery. As you can see, my daughter normal, and thankfully, here is between her friends, share their celebration. Let me talk about the needles GcMAF. We used the first one for 3 months, and after nearly 6 weeks, we started the second one, of course, under supervision of you. The more important improvements that have occurred in my daughter after losing adults GcMAF, improvement of social communication, improvement of visual communication, and reduced hypersensitivity. Is very important. Improved hypersensitivity. As an example, when we went to hairdresser last time, she was normal, unlike previous time where she was screaming and crying out. Thank you very much.
Excuse me. The first video, is it like, that's the GcMAF? Is there a video that's loaded GcMAF? Like, can we see the difference?
Actually, there was one, but we couldn't get it in because of technical issues. But there was one, yes. This is the same child you just saw before. Now she's reading. Or at least naming the shapes. She's naming the colors.
Shata Amir, Khad Amir.
This child can now play with the Lego.
Khad Amir.
But unfortunately, this video is upside down. Sorry for that. Not because of GcMAF. Now after that, you will see that GcMAF will correct that.
Shata Amir, Khad Amir. Khad. شاطر أمير خد أمير شاطر أمير آخر واحدة شاطر أمير شاطر أمير clapping till now okay أمير وين السيارة أمير وين السيارة أمير أمير وين السيارة شاطر أمير خد أمير
That's it. Any question?
Yes.
I can't hear you. Just wait for the mic.
Wait.
Wait a little bit.
Hello. Like, how can we do the treatment interfere with this? Like, how can we be sure that there was no other confounding variables which said that this GcMAF was the only thing which brought the change because we didn't see the baseline? The difference? Like, was the data taken down on the behavior? How many times did he speak? How many times did he, how many words did he got into 1 week or something
Well, those kids were on treatment before the GcMAF. They were on the biomedical therapy, including diet and supplements and detox. But the improvement in few of them, or in some of them, were not that good. After we added the GcMAF, the acceleration of improvement was really dramatic. In some of them, as I said, they were non-verbal before the GcMAF. Even I have a child, 12-year-old, his mom told me he tried all kinds of therapy, including hyperbaric oxygen, 3 times. 3 courses, each course 40 sessions, total of 120 hyperbaric oxygen therapy. And he never spoke a word. She used GcMAF, 2 vials, 25 weeks. He started talking. And that's also on the internet. Other kids, you know, they were like violent, they were antisocial, they were verbal, but other symptoms still lagging behind, like behavior. After GcMAF, they were better concentration, better attention, and listen to the orders better.
Yes.
Oh, Doctor, I've got the microphone. That was a fantastic lecture, thank you. Do you use the GcMAF yogurt? Have you tried that as well?
No, we only use GcMAF injectable.
Okay, thanks. I love the yogurt, and I just wanted to see if you had tried that with the children. Okay. Thank you.
Thanks.
Hi, Doctor. I have 3 questions.
Yes.
It said on the website that you need to do a Nagalese test before administering this GcMAF.
I wish we had.
That's right. Unfortunately, we do not have this test. So without Nagalese test, do you proceed with the GcMAF treatment?
Yes. Yeah, I prefer to get the benefit of GcMAF rather than waiting another year or so waiting for Nagalese to be available in my country. Because as you know, in Jordan or even in the whole Middle East, we don't have Nagalese test available. The closest place was in Holland. And the test is so hard to do because you have to send frozen serum to Holland and it should arrive frozen. And who can guarantee sending serum from Jordan to Holland or to Germany or to USA and still okay to be the test? So I choose to do the GcMAF to get the child benefit. Of course, we did vitamin D testing.
EMA, I should point out that EMA owns the company in the Netherlands that does the GcMAF testing. The Nagalese testing. EMA.
Yes, sorry, I have to speaker. So, I'm happy to announce to the doctor the nice talk about from Germany, from Jordan, that now we have a new kit. I will give you the kit straight away where you don't have to send it frozen.
Great!
Yes, so that's what it just started to come out. I just spoke a little bit about it yesterday. Okay? Sorry, but I have to space a few words about this. Yes.
Thank you. That's great.
I will give you the kit, yes, right now.
Thanks.
Hello? Doctor, you said that the negative part of administering GcMAF is that you tend to see kids more hyperactive.
Yes.
So did you notice this hyperactiveness in all those kids that you have treated, or it is only in some cases that hyperactiveness appears?
Not in every kid we notice hyperactivity. I would say about 40% of the time there was some hyperactivity, although it was also temporary.